Welcome to Eye Contact. I'm Aidan Hanratty. Welcome, Dr. Güell.
Hello.
Where do phakic IOLs fit into the management of progressive keratoconus?
So progressive keratoconus is a disease, and so there is only one well-perceived treatment for progressive keratoconus, which is cross-link. In some circumstances, keratoconus, when you start dealing with a patient with keratoconus is already stabilized. If this is not the case, your role, and this is an important role, is to stop this progression. Once we have a stable keratoconus, there are many ways of trying to correct the associated refractive error. In most of the cases, we will do it either with spectacles or with contact lenses. Mm-hmm. This is a field where contact lens specialists has a lot of things to say and to do. But there are particular circumstances, personal or because patients are intolerant to contact lenses or for many reasons, they might not be comfortable with them. So to correct them, you might, in this stable keratoconus, might consider to do refractive surgery because those corneal refractive surgical procedures are obviously contraindicated, again, in most circumstances, because there are some indications. Phakic IOLs, in these cases, has a significant role.
What kind of clinical trial data is there to support a combined approach with phakic IOLs and cross-linking?
Well, there are a significant number of published papers since, I would say, the beginning, I would say since 2003 up to now, and using different kind of combinations, as I mentioned. First of all, stabilizing the keratoconus, either with cross-link or simply waiting until it's autonomous, let's say, stabilization. And then some groups have used intracorneal ring segments to improve the irregularity of the cornea, which is something that obviously you cannot do with an intraocular lens, and using phakic lenses with or without previous intracorneal ring segments. So I would say that probably there has been about 15, 16 papers published since then.
So a lot.
Yeah, not many cases in each paper, because as you can imagine, this is a not so common situation. As I mentioned, in most circumstances, these patients can be corrected with spectacles, with non-surgical approaches.
Mm-hmm. And how do you select patients for this approach?
Yes, I was specifically interested in, on one side, in keratoconus. I am a corneal surgeon, basically, so I've been dealing with patients with keratoconus for all my career, but also with phakic lenses. So, and I've been using them in a significant number of cases.
Okay. Are you typically using toric phakic IOLs?
Well, as I mentioned, in most cases, not in all cases, but in most cases, the main problem for keratoconic eyes from a refractive point of view is astigmatism. Mm-hmm. Of course, astigmatism in this particular group of patients can be divided in irregular and regular. The irregular component cannot be corrected with phakic lenses, as it cannot be corrected with the spectacles. It might be corrected with contact lenses, rigid, or with the use of segments, or with the use of topo-guided ablations with the excimer laser combined with cross-link. So, but the regular component of the astigmatism, one of the ways that you can correct is with phakic lenses. Of course, you can also correct myopia or hyperopia, because sometimes there's specific keratoconic cases with astigmatism and a spherical problem. No? But most of the cases is astigmatism.
Okay. And what is the sequence of surgery in terms of the time gap between cross-linking and phakic lens implantation?
Well, this is a good question because there is not a absolutely clear answer. Conceptually, I need to see is 2 consecutive refractions and topographies with no significant difference, separated about 3 months.
Okay.
So usually you get that, although this will depend on the particular case, so you cannot generalize for every keratoconic eye, but usually this is between 6 to 9 to 12, between 6 and 12 months.
Okay.
So usually after this stabilization procedure or corneal procedure, because sometimes you, as I mentioned, you will use segments, I like to wait for these 2 consecutive similar refractions, and usually I do the second surgery, so the implantation about 6 to 12 months after the surgery.
Thank you for joining us.
It has been my pleasure.
For more information, please visit us at eurotimes.org.